Hi everybody, you're all very welcome today and thank you for joining to listen to this presentation. Just a wee bit about myself. First of all, my name is Diane McGarvey and I work in the Learning and Development team in the Northern Trust. I have been a PIP representative there for, the last 14 years. Doesn't feel like that long, but it is. My own PIP journey, my own learning and development journey, I started as a qualified social worker and I undertook PQ1 to 6, which would have been in the older PQ framework. And then when the new PIP framework came in with NISC, I did my practice teaching award and therefore gained the full specialist award. And then just recently, I have completed the 3 years of the research methods program. So year 1, which is the REM program. The year 2 is carrying out this piece of research, which I'm presenting on today. And then year 3 was working towards publication. So I'm delighted to be able to say that this piece of research is now being published on the Journal of Social Work Education. So I like to take this opportunity at this stage, at this initial stage of the presentation, to thank my colleagues and tutors who helped me and supported me through this PIP learning journey, and my co-authors, Emma McGuinness at Ulster University and Carol Kirk, who is also part of the Learning and Development team in the Northern Trust, who supported me with this publication. So thank you very much to all those people. Sorry, I'm just turning on my computer here it's gone off. So really then to get into this title of the study is what are the facilitating and restraining factors that influence practitioners' decision making on whether to engage with post-qualifying assessed programs. So for the purpose of this study, we were looking at PIP programs that are academically assessed rather than those that weren't. So what was really my interest was to find out, as a PIP lead, what are the benefits for social work staff who come through that process of applying for a PIP academic programme, who gain their PIP award and also some of their academic credits, and who have to go through the assessed learning part, which is completing assignments, presentations that are maybe marked as well, and doing that alongside their work. So I was interested to see what the benefits of that were, but I was also interested to see and to hear from people who maybe weren't part of that process, who haven't been able to engage with the PIP framework under those assessed programs, and then finding out if there was any way that we could make recommendations for practice and maybe support further engagement, if the benefits outweighed not partaking. So that's really a bit of an overview around this presentation. So from April 2011, the Social Care Council introduced a mandatory condition for re-registration for social work practitioners to achieve part of a post-qualifying award. So you'll all probably know of that, which is 2 professional and practice requirements. So you'll see from this slide that research highlights that there is a need to continually improve practice throughout one's career to enhance competence and manage complex caseloads. So for social workers who are qualified prior to 2011, there still remains no mandatory condition to complete part of a PIP award, although it would be an expectation from organisations that they would try and participate or uptake some of the applications for PQ programs. So therefore, there does remain a number of practitioners who have not engaged or achieved post-qualifying qualifications to date. So this is some of the stats from Social Care Council's live register in 2024. So you'll see from those stats that 39% of the social work workforce in Northern Ireland have completed full awards. There's a further 18% that were progressing and that could be higher now at this stage. This is looking at the 2024 register. But it really does, what it does highlight and confirm is that about 44% of the population, the social work population, have either not engaged or have attempted to and then have withdrew. So over half, or just under half. So therefore, it was important to find out reasons why that there is some non-engagement still. So the aims of this study were to explore the perceptions of those who have and have not engaged with post-qualifying assessed study. If it benefited those who have, to explore what might encourage those who haven't applied, and also to make recommendations to promote further engagement in the future. So prior to completing this service evaluation, I had written a systematic narrative review, which was the first year of the Research Methods programme, and that was really looking at online teaching post the pandemic. So another aim of this study was also to ascertain the views of hybrid learning approach and whether that was beneficial or encouraged applications onto the PIP framework, or whether it was a limitation. So that was another aim as well. So just to look at some underlying theory before we get into the study. So Taylor et al., you will all know Brian Taylor. He states that education should extend beyond undergraduate to postgraduate to maintain effectiveness in meeting client needs. Although there remains a number of social work practitioners within Northern Ireland who have chosen not to undertake assessed PQ practice. So it's really to try and unpick why that might be. So one of the reasons, or one way to explain the why, is looking at the job demand resources model. So this model can be used to analyse it further. So job demands are really considered as tasks such as workload, learning and development, administration tasks, all those parts of the job that social workers do. And the resources element of it is considered as supportive functions to do that job, such as supervision or being able to be supported to make more autonomous decisions and engage in learning activities to enhance competence and confidence. So there needs to be a kind of an equal balance between demands and resources for practitioners to feel job satisfaction and support, and to be able to maintain that confidence and competence in practice. So when the job demands are higher than job resources, this can lead to burnout and it can decrease job satisfaction. And there's some research that would highlight that. Research also highlights that engagement in post-qualifying programs can increase job resources, which correlates with overall job satisfaction and job retention. So this would indicate the importance of encouraging practitioners to participate in post-qualifying study, and if it greatly did benefit the organisation and its ability to retain staff and enhance services. So that's what the aim of this study was to look at. Other reasons for possible non-engagement can also be explained using ecological systems theory. So at a micro level, there are continued reported staff retention issues that can lead to burnout and increased sick leave. There are issues impacted at a micro level due to the rise in complex casework, austerity policy leading to a rise in the working poor that also increases stress for our staff. We also see that full-time staff are increasingly seeking extra working hours and overtime to increase their pay, which will also impact on study time as well. And then to look at the Northern Ireland Social Work Workforce Review, it evidences this further. It highlights that Northern Ireland has a 25% higher rate of mental health diagnosis than other parts of the UK. Northern Ireland has the highest level of deprivation, poverty and trauma. There's a high rate of domestic suicides and homicides, domestic abuse, a growing ageing population, and arguably leading to a greater service dependency and larger caseloads. So we can see that this all could be an impact as well on the uptake of PIP programmes. Understanding new public managerialism is a term used to describe neoliberal aligned administrative approach which to improve efficiency, performance and accountability of organisations. So this approach kind of emphasises performance indicators, meeting targets, places priorities and risk management, and training and maintaining targets for mandatory training to be met. This can push practice towards a tick box compliance and limit social workers' discretion and professional judgments, also impacting on relationship-based practice. This can be problematic given the complexity and the legacy of conflict, poverty and community trauma in Northern Ireland that often requires practitioners to be more reflexive and flexible in building relationships. Therefore, this study was important to find out if PIP assessed practice was encouraging more reflexivity and autonomy and professional judgments and building relationships in practice, or is it impacted by this type of neoliberal approach? So really to come into the nitty-gritty of the actual project, so it was a small-scale service evaluation, and the methodology used to undertake this study was a qualitative approach using semi-structured interview schedules. So focus groups was a method used to collect data from participants who had achieved post-qualifying requirements, as they were viewed as possibly more willing to participate in the study. They had similar achievements, so maybe within a group approach that they could bounce off each other and talk about some of their learning and processes and engagement and what they achieved through that process. However, the participants who had not engaged in post-qualifying study were harder to reach. And that really could be that they may have felt there may have been a level of fear of being judged for not engaging, or they may have more negative feelings relating to the restraining factors. And therefore, I carried out individual interviews with those people who did come forward in the end. So the sample size included 1 male and 10 female social work practitioners, all beyond AYE. And they all came from different areas of social work practice and different stages in their career. Some newly qualified, some in practice maybe over 10 years. And it ranged from practitioners from children's services, hospital, mental health, older people. So a range of different areas of work as well. So when we looked at the findings, there were 9 sub-themes that were divided into 3 overarching themes. And the 3 overarching themes were culture, connections, and communication. So here are the 3 overarching sub-themes. And we found from analysing the findings that participants reported that career progression was a highly motivating factor to undertake assessed study, with several participants changing career following successful completion. However, others reported that they were not interested in any sort of career change, yet would feel motivated to undertake study if there was more of a financial incentive, as work easement was an ongoing problem for all participants. This led to feelings of guilt of having to put pressure on their colleagues to cover their casework when studying, and however, some reported if there was a financial incentive, such as receiving overtime payments for extra work to complete post-qualifying study, they would prioritise work and complete study in their own time. And this would reduce feelings of guilt and enhance motivation to progress to the end of the study experience. There was also repeated quite frequently from participants that there were tensions between training to do the job and education. Often post-qualifying opportunities were not actively encouraged as line managers were concerned about losing good staff if they changed career following completion of PIP awards, or there was more priority given to being released for training to do the job rather than assessed learning that enhanced critical thinking. Although those who did achieve PIP requirements, they reported feeling supported and connected to their peers and teaching staff when studying, and reported an increase in confidence and competence that improved their practice significantly. Those who hadn't engaged in post-qualifying study reported having limited knowledge of the learning content around the different programmes and pathways, as well as what the learning outcomes could be achieved, and how would that help their job role and how could it benefit them more. They stated that when publicity emails came through advertising PIP programs, that they were not actively encouraged to apply, as they were unaware of how the program might benefit them. Some reported that PIP discussions were low down on the agenda, partly due to managers having limited knowledge of the programs, or there was a mention, or if there was a mention of a PIP program being circulated, they weren't actively really encouraged to look further into it. However, some of the participants who did achieve PIP requirements reported having a manager who was really passionate about PIP and who had actually gone through PIP programs themselves and had achieved PIP awards themselves. So they seemed to more actively encourage their staff members to look into PIP further. So you'll see from this quote, this is a participant who was motivated to achieve post-qualifications as it led to a career change. However, they reported the same barriers as those who hadn't engaged in post-qualifying studies, such as lack of time, lack of work easement, leading to increased stress. And although they completed the programme as it was their incentive to change career, they reported ventilating their frustrations of the extra work commitment in their own time, which they feel may have put others in their team off applying for future courses. I'll give you a second to just look at that quote. And then this quote highlights that it's not only career change that motivates practitioners. Participants reported that following completion of post-qualifying programs, they felt more confident to mentor and support their colleagues with difficult, complex decisions, indicating qualities of having a collective leadership style by wanting to improve their service and their team knowledge. However, due to the extra commitment, they reported that if there was a payment incentive, particularly if they were enhancing their own practice and their colleagues' practice. So this incentive, financial incentive, did come up quite frequently. Those who completed PIP programs and valued the learning outcomes did report overwhelming feelings of guilt, as they did not want to add pressure to their work colleagues when they were taking time out to study. The guilt extended beyond colleagues to service users, as participants valued relationships and understood that service users who had already had several social workers prior, due to staff shortages, that asking colleagues to provide cover would be detrimental to the relationships that they had built with their service users. So, the message was that they continued to manage the dual demands of their work and study while completing PIP programs, rather than an impact on their service users. Or others would have said that was some of the reasons why they delayed applying for PIP study. So these quotes further highlight that training demands can be quite heavy. They always felt that they were updating training to do the job, and although they are still learning by doing that training, participants reported that the difference was they're not reflecting on the learning, which is the element of the learning that enhances professional curiosity. One participant reported that when working with a young teenage service user who remained reluctant to engage with any professional, that after she completed a PQ or PIP module, she was able to think so much deeper about the young person's disengagement, using the why question more, and being professionally curious due to critical thinking about the wider impacts that caused reluctance. She was then able to engage and make a real positive change for that service user. So she really benefited the PIP experience as it really enhanced her practice with the service user. So she reported that it was a direct impact of the learning and the reflection from the academic programme. Another participant reported that managers need to be more encouraging to apply, to encourage their practitioners to apply for PIP. It's not really being pushed. There seemed to be a fear that managers might lose good staff. However, the participant had stated that the PIP programme made her a better version of a social worker that she was, enhancing her practice with service users. So looking at the connections, a hybrid approach was very much welcomed by all participants. This suited them and the organisation. They reported, they said it was more effective in managing time that was really already limited. They enjoyed the peer connection with some face-to-face teaching. They felt that this was really important, and taking time away from the office was really valued. However, several days away from the office was reported as difficult to maintain. Being able to catch up on emails over lunch and after training finished, following online sessions, which appeared to be more time conducive. Those who completed PIP programmes were overwhelmed by the support and the encouragement that they received from mentors and teachers. They highlighted that this support was unknown when they were applying, and whenever emails are circulated with publicity, it doesn't really highlight this level of support. But the high level of support saw them through to the end, and if this support was stated within publicity emails, they would have been less hesitant to apply. They think they would have been more ready to apply earlier as well, at an earlier stage. Professional curiosity was a reported benefit from all who had undertaken PIP programmes. They became more reflexive and developed deeper understandings of service user issues, reporting better connections with service users. Confidence had increased, and those who had achieved PIP requirements reported that their confidence and competence was witnessed by others in their team, who came to them for guidance and support, demonstrating collective leadership qualities following PIP achievements. So participants reported that they valued the learning from PIP assessed programmes as it enhanced critical analysis and reflection on practice knowledge. Yet mandatory training was given priority, whereby managers often did encourage the applications for PIP due to lack of staff who are maybe already taking on other training tasks and lack of time available to attend. This could further imply that the new public managerialism has an important impact, or has an impact, sorry, not an important impact, has an impact on service managers who may wish the best for their staff, but are impacted by these managerial tasks and targets to evidence performance and accountability. And these quotes further highlight that post-qualification programmes are not always communicated by managers due to fear of losing staff and trying to continually manage competing demands of keeping the service going by firefighting high caseloads and releasing staff for organisational training. I'll let you read those quotes.
Yeah, and I'll maybe ask a question just as well in a wee minute, if you don't mind. I know we said we'd do it at the end, but I think it's relevant just to what you're talking about. That's okay.
Do you want to ask it now, Heather?
Yep, it's just as Chris actually had mentioned, I know maybe what you've said now kind of explains that as well, but I know you're talking about assess programmes, and the title talks about post-qualifying assess programmes. Does that mean the ones that just involve academic marking, Chris is asking, or the broader opportunities just to achieve a PQ award?
It's really those who have to do the extra bit of putting together some sort of submission. So whether that's through an individual assessment route, so it may not be always academically assessed. There are some of the other PIP programs that are aligned to the PIP awards that aren't academically assessed, but there's still presentations to put together. There's still some reflective writing journals and things like that to put together. So they're assessed in a way against the PIP requirements. So in order to achieve PIP requirements from the PIP awards, usually there is an assessed piece of work that needs to show that you've demonstrated and met that. And then alongside that, you have the PIP academic programs, which have assignments that are marked, academically marked, or presentations that are academically marked. Hopefully that answers your question.
Thank you. Hopefully it does, Chris. I'll go back on mute. Thanks, Diane.
So this really leads me in now to the discussion. So that's the findings. We're now into the discussion of the research. So just to really highlight the limitations of this study, it is a small scale study. It was aligned to one trust area only due to time restrictions. And although there was only one male and 10 females, but when we look at the overall stats for the broader social work population in Northern Ireland, the ratio between male and female would be lower. So if we go back to the job demands resources model and we look at what may be high demands, so what is the high demands that could be barriers for the uptake of any sort of PIP application or program. So the findings really reported that, there really was a general discussion overall from all participants that there is increased workload, staff sickness, and lack of workload easement, which can really hinder PQ engagement. And that workload easement, so yes, there were study days, but the overwhelming feeling of guilt that I reported on meant that they continued to work with their high caseloads and try and manage that with the demands of study at the same time, because they were really connected to their service user group. For those who have not engaged in PIP programs, although there was a sense of willingness, they were really impacted by work pressures, again, increased workloads, staff retention issues, and a lack of work easement, increased risk of burnout when engaging with PIP programs. So they did report that overwhelming feeling of stress having to do both. But when we look at the benefits of PIP programs and those who have achieved, and we see the real benefits that they reported, this increases the resources part, the high resources of the job demands model. So the high quality supportive relationship with a skilled manager can really increase job resources. Encouraging support from mentors has been highlighted as a motivator to see PQ training to the end and its process. So there was no overwhelming response to the support, and being able to email or contact a teacher, a trainer, a mentor at any time, and to be supported through writing assignments, particularly when there were candidates who hadn't written an assignment in quite a long time. Having a leader who's passionate about PQ study really increased motivation to apply and complete PQ learning. And learning outcomes have been linked to career progression, job satisfaction, and an increase in professional curiosity that enhanced positive relationships with service users. Sorry, my computer's keeps going off. I'm just putting it back on. 2 seconds. So participants all reported a deeper sense of understanding of service users' issues, increasing professional curiosity during and after PIP learning. So I think that was a really good benefit to highlight again. And there was a few participants who reported working with reluctant service users who were unwilling to engage, who didn't turn up for appointments, who had gone through several different professionals, and again it was reported that they weren't engaging, and they found that after attending teaching and through support and identifying this as a case example for their assignment and examining it through writing that assignment, and looking at the wider issues around what may be impacting on that service user, that they really developed a new approach to engagement, and you know, examples of positive benefits were reported. Participants also reported this level of ongoing relationships that they had built within their teams and with their managers, and it was built on mutual understanding of the complexity of their caseworks, and this perceived level of social safety played a really important part in their decision to remain in their roles rather than take time out to study. So there was a lot of talk about this feelings of guilt and not wanting to put pressure on each other or their service users. Yet the importance of encouraging and supporting staff to take time out to study has many benefits, including that of enhancing psychological safety, which really increases staff retention. And there is research to value that. Edmondson, for example, would argue that in a financial organisation, including government institutions, employing highly skilled and motivated individuals is not in itself sufficient. Sustained organisational learning requires cultivating open team communication within an environment free from interpersonal fear, where individuals are not restricted to task-orientated learning and target-driven roles. Rather, that they're encouraged to take interpersonal risks to optimise team performance in knowledge-intensive contexts. So the findings of this project highlighted that the competing demands for managers to ensure staff have mandatory training and also fear of losing skilled staff post-PQ study reduced the uptake of PQ applications, some often referring to it as an optional extra. These perspectives, coupled with unaddressed or unsupported feelings of guilt, may undermine the efforts to foster that psychological safety and encourage and support people through professional development to gain PIP awards. Recruitment and retention is an ongoing topic of discussion, particularly in the social work profession. However, when an organisation supports career development and professional development, which was highlighted in some of the findings of this study and other studies as well, that it can lead to higher rates of staff retention. So those with strong connections with enablers were more likely to progress through PQ education and have successful learning outcomes, and reported feeling more satisfied in their job, more invigorated, that they had remained static for a level of time, but once they participated in the learning, that they felt more invigorated and a new sense of nearly self-worth, and as one person said, they nearly found a better version of themselves following completion. So just to sum up and look at some of the conclusions. So the benefits of completing PQ study have been linked to better outcomes for service users, increased competence and confidence in the social work role, job satisfaction, collective leadership qualities, which is linked into the leadership framework, as social workers became leaders in practice and became mentors for other colleagues within their team, and encouraged others to uptake the learning as well. Those who didn't undertake PQ study, there was a sense that they were willing to and wanted to, but yet training demands to do the job were higher. Possibly the way PQ was communicated as well may have had an impact on that, because they did report that when publicity went out, it was more about title of the course, dates, time frame, commitment, rather than what support may be available, what will they learn through this course, and what's going to benefit them doing it, what's the learning outcomes. So that was maybe restricting people to consider applying. Some reported that their line managers maybe had limited knowledge of the PQ process itself, and therefore it was not really on the agenda. Some were unaware of the support available and the learning outcomes. Enhancing collective leadership styles and practitioners is value for money really for the organisation. It promotes staff retention and job satisfaction. So it's really in our benefit to try to encourage for more to come out and to participate in PIP practice. So some of the recommendations from this study was, well, the incentive to study appeared to be very important for people. That was something maybe to look at or to address. Publicity and marketing should highlight learning outcomes and links to career progression. So more information at the marketing stage. Marketing should highlight the level of support available during PQ study, highlight that they will possibly have a mentor depending on the programme, who they can contact if they need support with assignments, the links maybe to student support areas in universities if the course is connected to a university. Easement remains an issue. And that's really, due to all the different wider impacts in the ever-evolving landscape of practice. And however, if work is completed in personal time and was possibly paid as an overtime, it would enhance motivation. And a hybrid approach is very welcomed and should continue within PIP programmes. So the benefits for the organisation, so higher employee engagement and retention, stronger team capabilities. It deepens professional curiosity, enhancing positive change for service users, and it develops leadership qualities outlined within the leadership framework. So that is the end of my presentation. This is a QR code that will take you directly to the published article. If you want to read up on that further, you can use the QR code or you can click on the link. I'm not sure, Heather, if this presentation has been sent out to people or not, but if anyone needs further information on how to maybe get the article, if you're interested in it, you can send me an email as well. So that is me. Thank you for listening.